Hey guys, Dr. Tyler here. Today we're going to be talking about neck stretching. This is going to help anybody who has stiffness, pain, any type of symptoms. If you've got a reverse curve in your neck or a straight neck, if you've got some degeneration in your neck, if you've got symptoms that aren't getting better or they're getting better and then they're coming back, doing corrective exercises is going to help you hold your adjustments and help get you out of that stress pattern. Couple things before we get started. Things to remember when it comes to stretching. Number one, consistency is everything. Consistency is what breaks patterns. Just like when you started as a patient here, we didn't start you on once every once in a while. We started you once, 2, 3 times a week, because that consistency is what gets your body out of stress, gets it moving into that healing pattern like you're created to be in. So if you have symptoms, if you have things you're struggling with, 1 or 2 days a week isn't going to cut it. Consistency, a daily basis, is what's going to break that pattern, get you back into that healing pattern, get things to hold. And then with that, just like when you get done with corrective care here, we move into maintenance care. Stretching when you have symptoms is great, but stretch when you don't have symptoms. Work towards doing it on a preventative to get flexibility, range of motion, mobility, and strength. Number 2 is, and this is something that a lot of people don't know, but you don't have to hold stretches for 45 seconds, a minute, 2 minutes. You can do shorter time with repetition, especially if you're in pain. So do 5 to 15 seconds, do 3 sets of 5 to 15 seconds, and then build up. And you can get back to those minute stretches, but build up. Don't start too strong, too fast. And the last thing is, and this goes for any kind of spinal stretching, do not stretch in order to create a pop or a release. What you want to do is you want to stretch to the point to feel relief of the muscle. Any type of pushing too far to force a pop might feel good for a moment, but it can create a misalignment, which causes the muscle to react. So when you're stretching, be light with it, be gentle. If it happens naturally, if a release happens naturally, that's okay. And then last thing is ask questions. If you have any questions about anything on the video, please don't hesitate to ask a doctor about it. So the first type of stretching we're going to go over is range of motion stretching. This is the most simple one, but also one of the most effective ones. Your neck can move 4 ways: flexion, extension, lateral flexion, and rotation. So we're going to go over 3 different ways to do range of motion. The first is active. Active stretching is you doing it all by yourself, getting those muscles to engage. This is going to help if you have stiffness, if you wake up stiff, if you have pain or symptoms, and if you've lost range of motion, you don't have as much mobility in your neck. And so what you want to do is start with flexion. You want to tuck your chin all the way down to your chest and then come back up. You can always add a 5 to 15 second stretch in which you go all the way down and hold it in that position for 5 to 15 seconds. The next is extension. This is one you have to be careful with, especially if you have any kind of nerve pain or disc issues. What you're going to do is you're just going to lean your head back as far as you can go and hold it there, or just come back to neutral. The next is lateral flexion. You're going to lean your ear to your shoulder to the best of your ability and come back or hold for a time. Do that on both sides. And then the last is rotation. And that is turning your chin to your shoulder as far as you can go on both sides. And that's the active. Once you feel comfortable with active, we can move up to passive. Passive helps with flexibility. So once again, any kind of pain symptoms, or if you've just lost range of motion, you don't have as much motion, you don't feel like you can move your neck as effectively. A lot of ways to say it is, when you're driving a car, can you turn over and see that car behind you really well? If not, this might be really good for you. So all that passive is adding a little push at the end. Once again, remember, you're not pushing to create any kind of crazy motion. You're doing it really lightly, 5 to 10%. So go back to flexion to start, flex down. Once you get to the end range of motion, as far as you can go, just lightly push down 5 to 10%. Hold that for 5 to 15 seconds and then come back. Extension, lean your head back as far as you can go. Once you're as far as you can go, just a little push on your chin, about 5 to 10%. Hold that for a few seconds, come back to normal. Lateral flexion, ear to shoulder. At the end range of motion, just a light pressure and hold that for a few seconds. Do that on both sides. And then last is rotation. Turn your head. Once you get to that end range of motion, just 5 to 10% of pressure, and you can hold that for a short amount of time. All right, the last form of range of motion stretching is called resistance. Now resistance you can do from the beginning, or you can upgrade, do active, then passive, then resistance. Resistance is gonna help with strength. This is long-term stability. So once you feel some mobility, flexibility come back in, add in some resistance range of motion. So all that we're gonna do is add a little bit of resistance. So what we're gonna do is for flexion, bring your chin all the way down. So rather than pushing down, you're going to put your hands on top of your head and you're gonna go opposite. So I'm gonna push my head up into my hands, hold that for 5 to 15 seconds, and then release. For extension, I'm going to bring my head all the way back, hands under the chin. So rather than pushing it more, I'm gonna push against myself. So push into my hands, hold that for a few seconds. Lateral flexion, go to in range of motion. Rather than pushing in, we're gonna push against my hand. So push against your hand for 5 to 15 seconds. And then lastly is rotation. So rotate as far as you can go. Hand here, push against your hand, 5 to 15 seconds. Make sure for lateral flexion rotation, you do both sides. So this stretch is called the chin tuck stretch, or some people call it the double chin because it's creating a double chin while you're doing it. This is gonna help in that upper area of your neck, really right under your skull if you have some occipital pain right under your skull, or if you have any symptoms from brainstem pressure, dizziness, headaches, brain fog, or you just hold a lot of tension up there. It's gonna help for anybody with that. So all you're gonna do is you're not going to pull your chin down, you're gonna push your chin inwards. So I'm just gonna push my chin back and you should feel it pretty immediately. Push, chin back, not down, but straight back. Hold that for a few seconds to as much as you need to. And then if you want to upgrade from that and get a little bit more stretch, you add in some flexion. So all I'm gonna do is push my chin in and then tuck my chin down. Push my chin in and then tuck down. And you should really feel it, especially on the outside. You've got 11 muscles that attach from your occiput, between your occiput C1 and C2. So it's a really important area to be taken care of. So this next stretch we're gonna do is gonna focus on your trapezius muscles. A lot of this is just across your shoulders. Your trap muscles attach all the way from the top vertebrae, your C1, come across your shoulder, and then go all the way down into your T8, T9 region. And so it creates a diamond on both sides. And so if you have issues in your upper back, postural issues, a lot of people just have tight shoulders. This is normally what they get massaged. If you've got any kind of nerve pain or nerve impingement going all the way down to your fingers or your shoulder, elbow, or wrist, this can help relieve that. So the best way to stretch your trap is what you're gonna do is if I'm trying to stretch my right trap, I'm gonna put my right arm behind my back. Now do this as best you can. You don't have to go all the way back, just enough to feel some tension. And then I'm gonna lean away from the muscle. So if I'm trying to stretch my right trap, I'm gonna lean to the left. Once again, hold this for 5 to 15 seconds or more if you're ready for it. From the back, what it looks like is right trap, right arm behind the back, lean left. Now, if you want to get a little bit more out of it, you know you're ready to upgrade, right hand behind the back, lean left, and then lean forward. Hold that for a certain amount of time. Go over and lean back and hold that for a certain amount of time. That is going to hit different areas of that trap muscle. So this next stretch we're gonna do targets your levator scapula muscle. So this is gonna help with anybody who has postural issues, stiff neck, pain and symptoms, and even issues down into your arm. That levator scap attaches from your neck to the top and sides of your shoulder blade or your scapula. So if you've seen our other videos, one of the best chest stretches you can do is a doorway stretch in which you prop that arm up into a doorway and lean forward. So you're gonna do the same motion for this. You can either prop up a door, a beam, some type of structure, or you can just do this in the air. So you're gonna put that arm up like this, field goal post, lean your head away and down. And you should really feel that stretch right across here. Once again, if you want to do a deeper stretch, use a structure so you can do a chest stretch and the lean and tilt, and that's going to work a lot of this area right here to get you some relief. Make sure to do that on both sides. So the next thing we're going to do is a different stretch. It's called nerve flossing or nerve glide test. This is different than a muscle stretch because we're working specifically on a nerve. The purpose of this is your nerves can act like rubber bands in a sense. And what you can do is you can move those nerves to help release some tension in them and get some function back. This is going to help if you have any kind of shooting pain coming down from your neck and follows this nerve path all the way to these 3 fingers. Also, if you have carpal tunnel, this is going to help you tremendously. Whether you've had carpal tunnel surgery or not, this is going to help you. Reason being is a lot of people have carpal tunnel surgery at the symptom area, even though the cause was here. So this can help if you had unsuccessful carpal tunnel surgery. This is also a good preventative stretch. Just like any other kind of stretching, if you have no issues, do this stretch. It's going to help get things moving, keep things from happening, okay? So what you're going to do this floss, you're going to extend your arm straight out. You're going to extend your wrist so your palm's facing downwards, or as best you can. You're going to turn your head away and you're going to lean down. And you should really feel it coming through this arm. Now, a little bit of pain is normal on this because you're working directly on a nerve. So if you feel a little bit of pain and irritation, that's actually a good thing. That means you're doing it right. Now, if it's 10 out of 10 pain, stop and find something else to do, okay? So this is the floss. And then to continue to floss it, because you think about flossing, you're going back and forth like when you're flossing your teeth. So in order to do that, you go to in range of motion here. And all I'm going to do is the first step, you can just put your wrist into flexion and extension. Start here, and if you need an upgrade from this, what you can do is bring your head back to neutral while you're flexing and extending that wrist. And so this is that flossing motion. All right, so the next flossing is going to be on your radial nerve. So we did median nerve, we're going to do radial nerve. This is going to help anybody who has issues coming down from their neck, especially their lower neck, come into their inner arm, and it can even go to your last 2 fingers. Once again, this is also a really good preventative stretch. So different from the median nerve, instead of pushing the palm down, we're going to flex our wrist in. So what you want to do with this is come in, flex your wrist down, and then all you're going to do is kind of torque it down like this, okay? Similar to the median nerve, for the radial nerve, we're going to turn away and flex down, okay? And if you need to feel more stretch, you can really extend that arm back. But once again, start where you can and work up to more motion as you feel better and you feel more release. So, flex that wrist down, turn, come down, turn your head, lean it forward. I'm gonna bring my arm back for a lot more stretch. And then to get to that flossing motion, what we're gonna do is we're gonna release my neck and hand at the same time. So I'm gonna release, come back, release, come back. And you can do that just with like the median nerve. You can do that for sets. You can do 3 sets of 10, or you can do hold for 15 seconds at in range of motion. Whatever you need to do a couple different things, see what works best for you. So next one I want to talk about is what to do when stretching isn't doing enough. Now, stretching helps everybody, but sometimes with certain scenarios, certain symptoms, certain cases that you're dealing with, injuries, things like that, you need a little bit more to get that soft tissue, the muscles and the ligaments to be at ease. So the number one thing I want to recommend is doing massage therapy. You know, there's a reason we have massage in all the clinics. It's because it so works hand in hand in what we're doing here. You know, we've got great massage therapists that they can do either a gentle massage or a deep tissue massage. And what they'll do, especially with the deep tissue, is hit certain trigger points where that muscle is bound and help it to release. Now, if massage isn't as available for you, or if you want to do more at-home stuff, there's a couple instruments that you can use to help release muscles, but also work on getting the curve back in your neck. And that lack of curve is what causes a lot of chronic tightness for people. So the first thing I want to show you is doing some cervical traction. Now, favorite way to do this is with a towel, because everybody's got towels at home, and I'll show you the actual traction units here in the office. If you want to use those while you're here, you don't have to have permission to use those. If it's something that you're dealing with, let us know and we'll get you set up on those cervical traction units. But what you can do is get a towel, fold it long ways, okay? And then all you're gonna do is you're gonna set it at the base of your neck, okay? You don't want to be up here in the skull. That can cause some issues. You want to put it at the base of your neck where the middle of your curve is, okay? And then all you're going to do is, before you do any kind of pulling, just let your head lean back a little bit. And then you're going to do, once again, not 100% pull, maybe about a 50% pull with this. And you're going to pull the towel forward and up. So it should create a little bit of an angle, and let that head fall back and pull forward and up, okay? Hold that for a short amount of time and then relax. Now, once again, you can work up in traction just like stretching. You can start small and work your way up all the way up to 2, 3, 4, 5 minutes. But if it's your first time doing it, start small, do repetitions. Do 3 sets of 15 seconds, 3 sets of 30 seconds, just to get those muscles to retrain. Now, the next instrument that you can use is something called a Thera-ball. So we sell these in office. You can use any kind of ball. Thera-ball is one of the best. Lacrosse ball is another really good one. You can use a tennis ball and softball and things like that, but they have a little more give. You need something that's really solid. So if you need a Thera-ball, we've got them in stock. You can also get them at Walmart, find them on Amazon. But what's really good about this, and you can see these little divots in this. So let's say I'm trying to work out my trap muscle. Anytime that you're trying to work out a muscle with the ball, what you're gonna wanna do is you're gonna wanna find those trigger points. And everybody knows where those trigger points is where you push in and you feel the most tension or tenderness or pain. So when you're using that ball, you can do one of 2 ways. The first way is get on that trigger point and you can push that ball in, and you wanna get to about a 7 out of 10 pain level. You know, normally with stretching, like if it hurts, don't do it. But with this, to release a trigger point, you want to get on that trigger point 7 out of 10 pain level and really push into it. And you're going to hold that for about 10 to 15 seconds. And then you're going to release. And you can redo that over and over again. And that's going to help really get deep into those muscle tissues and help get some release. Another way you can do it is obviously the rolling technique. And that's why there's these little divots. You got to know kind of the path of the muscle, so your trap muscle runs long ways. So what you want to do is go against the grain. You want to, instead of go long ways, you want to go short ways against it. So you can get that Thera-ball and you can roll it against the grain, rolling it all against that trap muscle. And my trap's really tight, so this is kind of hurting me a little bit, but in a good way. Okay, so you can roll against the grain. If you need to know which way the muscles are going, ask us or look up a picture of those muscles. And whatever way it's running, you want to go the opposite way. Now, the last way you can do it is obviously you can lay on it. You can put it behind your shoulder blade. If I were going to try to release my shoulder blade, I'd get up against a wall. I'd put that ball in between my shoulder blade, and I would push up against the wall and roll up and down, side to side, circles. And that's going to help release that a little bit better. So once again, if you need one of these, we have them in stock, but you can also just use stuff at home that looks similar to it. The harder the better, because that's going to give you a little bit more deep tissue work to get these muscles to release. The next thing I want to show you is a cervical wedge. Now you can get this on Amazon, you can get it at different stores. We sell them in office. It's another way to get traction on your neck, which is going to decompress your neck, help restore the curve, and help release those muscles. This unit looks like this. You lay down on the ground and put your neck right in this crevice, starting small, working up in time. If you want one of these, let one of the girls know, let one of the doctors know, and we can get you hooked up with one of these cervical wedges. Hey guys, last thing on this video, I want to show you the cervical traction units. Now this is something you can use in-house. If you have neck tightness, chronic neck tightness, if you know that you've lost the curve in your neck, ask us about these. Normally in your care plan, we do this at a certain time in your care, but if we need to do this earlier, or if you ask us, we definitely will. So I want to show you how to use it real quick. All you're going to do is you're going to put this piece at the base of your neck, okay? You're going to put this piece under your chin. First thing you do is step all the way back until it's tight, okay? And then from there, you're going to get a good wide base with your feet. Bring your feet forward just a little bit, enough that you should feel like you're able to lean back and it holds your weight and it's pulling you upwards, okay? Now a lot of people try to pull down or they try to squat and it doesn't do exactly right. You should be able to just lean back. And then all you're gonna do to add a little bit more upwards movement is you're not gonna squat, you're gonna let your butt go backwards. During that time, you're taking deep breaths in and out. That's creating some space, pumping your disc back in, helping to relieve some of those muscles. With the time limits, just ask us. We'll tell you specific times to do, and we'll work you up in your traction.